Yeah. Hey. All right. Hey. Yeah, I mean.
So we about to take off.
Hey. Please do remain calm. About to run the game, spitting with a little bit of soul, no times. Bread on tummy time.
Welcome to the Please Remain Calm podcast. I am Ben Gonzalez.
And I am Daniel Gonzalez.
And we are here right now with our guest, Stacy Sasada. Say hello.
Hi, guys.
Hi,
Stacy. Stacy's a licensed clinical social worker. She has her master's in gerontology and social work from USC. And I thought today, since she was available today, I thought we would base today on like psych calls.
Yep.
And man, psych calls.
Yeah. I mean, we always do a different kind of call for every episode, and psych call is a call that literally everyone runs on in EMS or just first responders, period, every single day. If you're an EMT, if you're a paramedic, if you're a volunteer fireman.
And depending on where you work, man, I mean, you could run on multiple psych calls a day,
Exactly.
like where I work, in Venice.
Yeah.
And, there's different concentrations of people like that have psych issues that either couldn't find any treatment, couldn't find housing, chose on their own that they didn't want to get treatment, didn't want to get housing, didn't want to be at the place where they were getting treatment and housing.
Don't think that they're a psych.
Or don't think that they're a psych, And then what happens in those situations when you can't hold down a job?
Right.
When you can't be like a functioning member of society, you wind up on the street.
Right. That's what we're saying to set this up. Like, there's a whole gamut of psychiatric patients that you can run into. There are people who are, psychosis their entire life. They've been dealing with it, schizophrenic. They have real serious diagnoses. There's other people who are just having a really hard time in life at the moment. And you kind of can drift into being, a diagnosed psych for a minute and come back from it, go in and out, basically.
Yep. Or you have something that can be treated with medication, and you're living life and you're functioning on it, and for some reason or another you're unable to get your medicine anymore. You lose your insurance.
Yeah,
And
or
some
it
people
needs to be adjusted.
some people actually think that, they start to feel better on the medication and decide, oh, I don't need it anymore. I'm
Exactly.
starting to feel really great.
Yep.
And then you have, an outbreak where
Yep.
I've
and
done that.
yeah, man, and then the other kind of difficult thing with psych patients is like, it's not always cut and dry if it's a psych patient or not.
Right.
You know what I'm saying?
It doesn't just present themselves like, hey, I'm a psych. I mean,
And-
some do.
And that's like, you can say that in general for like pretty much any fucking call that I go on. Like, it used to be, or you remember going through paramedic school, like you'd get a run and it'd be like, oh, chest, 45-year-old male chest pain. You're like,
Right.
okay, fuck yeah, chest pain. Okay, I'm going to ask, PQRST. I'm going to go down. I have all my list of chest pain questions that I'm
Right.
going to ask. And then you get there and the patient's like, not in any distress, they've got lower quadrant abdominal pain that they've had for 3 months. You're like, okay, shit, and you got to switch it up. It's kind of the same thing with like psych. We'll get like unknown medical, or
Right.
person down,
Mhm.
or assault, a fight in progress,
Mm-hmm.
unknown trouble, and you'll get in the notes, person walking down the street screaming.
Yeah. Or a seizure.
Or a naked person walking down the street. And it's like, oh shit, okay, I wonder what this is.
Right.
And I work on a 24-hour crisis line, so sometimes I get a call, a 15-year-old girl talking about her Snapchat or Instagram drama.
Yeah.
And then you dive in and she's like, yeah, I just don't want to be here anymore. And then you're like, oh, red flag. So do you mean that you're trying to commit suicide? And then it ends up being this whole psych call and she needs to be placed, when it started out as something you're just like,
Yeah.
oh, God.
Exactly.
It's like normal teenager conversation at first, then you dig in slightly and like, whoa.
Yeah.
Yeah.
And the same thing happens with, with our calls. Maybe you show up for something that they call 911 for, that you show up and you're kind of like, damn. Well, I mean, you don't know how many times a day I go, really? You call 911 for this?
Yeah.
You know what I mean? I'm thinking in my head, but you treat everyone, the same way. And it's the same thing. You get there, a teenager or something like that, call for something small, or they weren't acting right and they said something, that alerted their parents or worried their parents, that they called 911, and we show up and we're like, well, what's a medical complaint here? Because I'm a paramedic, and that's, I'm here to treat medical emergencies.
Yeah.
Well, he's just kind of, and they have a super vague story, and then it's like, okay, you got to kind of take a step back and try to figure out exactly what you're dealing with.
Right.
But the other end of the spectrum of that is, you can show up on calls and somebody's having a psychotic break, you know, and they're attacking someone at the moment. I mean, we've shown up and to fights, a full-blown fight in progress.
Oh, yeah.
That we had to actually act because somebody was getting beat, you know, and had to stop, or PD has to show up, and, you know, they don't know if the patient is psych or if, you know, they don't know what the heck is going on with the patient. So they have to take the patient down.
See, but that's the thing. When you're a paramedic, when you show up to runs, you're kind of a detective the entire time. So you're always kind of figuring out what's going on, what the case could be, what are the causes of what you're seeing. And psych cases can just present themselves like we're saying, like a million different ways.
Yeah, man.
Basically. And it can be a completely different case, something else that you're there for. It turns out that it's also a psych, or there's, you know, psych components to everything. And that will always make itself known. And it's always something that you have to account for when you're on the run.
Yeah.
And you've also mentioned before in other episodes how you see this all the time. You come in, you're kind of like nonchalant about it, but this is that person's first time. So if
Exactly.
it's their first time feeling suicidal, they're freaked out. You know, they haven't had police or firefighter encounters or encountering with mental health, and all of a sudden they're the star of like this whole thing.
And they're in a room full of them because you get a fire engine and a paramedic rescue usually with any call.
And the police.
And I think also too, and it's something that I've learned over years of patient interactions and dealing with different types of patients and stuff like that, is you really have to recognize when that's happening. When you have a patient that is kind of like teetering on the edge, if they want to open up to you or if they want to shut down, and your attitude showing up on scene is going to dictate and set the tone for that entire call.
Absolutely.
So like you can, like I have different, and we work with all kinds of different paramedics. Like I have my partner, Matt, who is a great medic, you know, looks out for people's best interest, is very knowledgeable and stuff like that. Me and him have been partners for a while and we work really well together. But then you got other guys that might be younger on the job, who don't have as much experience, who maybe are burned out from working, you know, at 9s on Skid Row and running 15, 20 calls a day on psych patients or people that have just OD'd or methed out or something like that. And they're over that kind of call, you know, and then they pick up an overtime day, an easy overtime day at the beach, you know, at Venice, and their attitude, and it's not to single out anyone in particular, I'm just throwing, you know.
How easy it can
this
happen.
happens to everybody.
It happens. Sure. And so if you show up on scene and you have somebody that's on the edge and they did something stupid, you know, maybe they put the hesitation, you know, like they were going to cut themselves, but they're not deep enough to really do anything, but they're just really a cry for help. If you come on scene and you go, come on, man, what are you doing? You know, come on, what are you doing? Yeah. If you're going to do something, you know, if you were going to do it, do it. If not, you know, come on, let's go to the hospital. Come on, I don't have time for this. And I've worked with people, you know, and I might have even been.
What are you doing?
Exactly, dude.
Yeah.
But I might have even been that person at a certain point in my career where I was short with patients and stuff like that.
And on the 24-hour crisis line, you know, you like that first, like you said, first interaction, first time you pick up the call. If you tell them, oh, it's okay, things are going to get better, minimize it, they're not going to open up to even tell you that other part of them feeling suicidal. So even just being validating and empathetic, you know, saying, okay, you're having this, even if I think it's stupid, right? I think it's this little Instagram drama.
I recognize it's important to you.
I recognize it's important to you. I can see how you're upset about that. Oh, it must hurt to feel that way when your friends leave you out.
Right.
To get it going so that you build that rapport right away.
Right. And that's important. I mean, rapport. Building a rapport with your patient, allowing them to feel comfortable with you to open up in general when you're talking about medical issues, when you're talking about personal medical issues, you know, if it's a female problem or something sensitive, you know, an injury to a male part or something like that. Building that patient rapport and letting the patient feel like you're there to help them.
Right.
It's huge. And it's multiplied 10 times when you're dealing with the psych issue, in my opinion.
And like you're saying, it starts from the minute you make contact, when you start the encounter.
Yeah. Oh, exactly.
I mean?
Dude.
You can't regain rapport that you didn't build from the beginning. You can't start to, you know, get somebody to trust you right from the middle of it.
Dude, I cannot tell you. Last night I did it. Where you get in the rig and you're like, oh, fuck, are you fucking kidding me? Come on, man. You know, and you're going in the call and you're tired and you're like, God damn it. And then you pull up on scene and, hey, man, what's going on? You know, hey, I'm Danny. I'm one of the paramedics. How can I help you? You know, and it's it really, I mean, I can't express it enough. It sets the tone for the entire interaction that you're going to have with that patient.
And I used to work in the emergency department too at in Hollywood, where there's a lot of homeless people.
Mm-hmm.
And I would say, this person is suicidal, and the doctor's like, no, he's just trying to get a bed.
Yep.
He's saying he's suicidal because he wants to sleep here and get a meal, and it's like, no, he's actually telling me a plan.
Or he wants meds, or he's a med seeker. You hear that a lot.
Yeah.
From, it's like, maybe they are. I don't know. But you can't approach it with that attitude.
Yeah.
You know what I mean? You have to approach it with, you have to give them the benefit of the doubt that they're actually seeking help.
Yeah.
Until they prove you wrong, which happens too.
You know what I mean? The challenge of working in this field with these kind of calls, though, is because it's such a repetitive nature of running on all these all the time. You have to fight that burnout and have a fresh approach every time. And people don't always understand how hard that is.
It's super difficult,
day
man.
in, day out, especially if you're a mental health worker. Like you're dealing with incredible things that nobody else has to deal with at their job, and you have to do it, every shift.
I remember being green social worker, and like someone said that they needed a sweater, and I'm like looking for their size, and I'm like, I'm sorry, dude, I only have this really large sweater, but it'll keep you warm. He's like, no worries, I was gonna sell it anyways. I'm like, I tried so hard to like help you, and then you have these older social workers that are just like, no, he doesn't need a sweater, he's fine, it's not that cold. It's LA.
It's and then you have something like that happen, and you can't get disillusioned by that, and put that label on everybody.
Yeah, you get jaded.
Yeah, you can't get jaded like that, and that's difficult to do, man. It's just like I've said before, like with cops, it's hard to just eat shit all day. You know what I mean? It's hard to like go about your day and everybody fucking hates you, and every interaction you have with people, you know what I mean, is negative. It weighs on you, just psychologically. You know what I mean? Whether you're a good person or not. And it's the same thing with psych issues. And I would imagine it's that way for people that work at like psych facilities and stuff like that.
It's got to be. Yeah.
Just like all day having to deal with that stuff.
Our shifts are 12-hour shifts.
Right.
So you get burned out at the end. And it's making sure you don't slip up and say something stupid like, I understand. And that person goes, you don't understand. How would you understand? Do you have mental illness? Rambles on, hangs up the phone on you. And you're like, damn, I messed up.
Yeah. I wonder what happened at that point. How many calls would you say you get in a 12-hour shift?
We should also maybe have you explain what you currently do, so we can get, because there's like a whole there's a whole medical infrastructure set up for psych calls and psych patients and everything, and like we can really get into that here that we have Stacy with us. Okay,
so I work for a hospital, and I work for their 24-hour psychiatric crisis line.
And it's an overall psychiatric crisis. It's not strictly suicide prevention.
No, it's open to everybody, all of Southern California, actually. So we can get multiple calls where you just call and say, hey, I need the number for this location. And you're like, okay, here it is.
Sure.
And then it could even be 20-hour long calls where you're actually trying to call the police, trying to locate the person since they're just calling and feeling, suicidal, and getting them placed in a facility, getting them to the emergency department. We don't actually treat them since it's on the call. Next caller, you have actually a screen above you that tells you how many people are on hold, and we don't want to go over a certain amount of minutes because then they can drop the call, and could be something important there. So that's what I do.
Basically it. Okay. Wow. And so kind of to take it back, might be a situation like a normal call that would call you, but would it be like a family member, or would it be like, what would you say is like the average call you get? The person that says, I think I need help and makes the call themselves, or is it a family member that calls?
Yeah, it's mostly the person that's calling that actually wants the help. Sometimes I'll get a parent who's like, my daughter is acting out. You need to speak to her. She's in the shower. Let me go get her. And then it's like, hold on, lady. Does she know that I'm calling? Maybe it's just giving her my phone number where she can call later, because I can tell you that teen's not going to be receptive talking to me about her suicide. So, but it's mostly the people who want the help that are calling.
Do you guys ever get calls from, if PD is on scene of an incident and they have somebody who they think could benefit from speaking to a crisis counselor or a suicide counselor? Do you guys ever get calls from PD like that, or you're normally the one that calls and tries to get PD there to send? Yeah,
we'll call PD. Let me, someone's in the Target parking lot and they're feeling suicidal, and trying to speak to them and keep it, just conversational while I'm still trying to gather information as to where they are.
Right.
And description of their car, and they already kind of know like, oh, okay, you're probably trying to send someone out to me. So it's a fine dance of
you've got to kind of do it like surreptitiously and not let them know that you're obtaining information while you're helping them.
Yeah, and sometimes it's good like when they haven't had this experience before, but then you get someone who has like bipolar disorder who has ups and downs all the time, and they maybe been suicidal before, and they're like, I already know what you're doing, and I'm not going to be put on a hold, so I'm not going to tell you that information.
Is PD the main entity that you have to send out to people, or do you have other like the PET team, or do you have different levels of people that you send out, or is it just
mostly the police department? Because we have like this little kind of like AOL Messenger thing within ourselves that I can like be on a call and tell one of my colleagues like, hey, I need you to call the police, and while I'm talking, I'm typing and I'm sending the information to her so that she can get it out to the police department. Now sometimes I do get calls from the PET team to say, hey,
and the PET team is this
psychiatric evaluation team.
And PET team, is that like a separate entity, or is that part of the hospital, or is it like an LA County thing?
So the agency I work for has their own
PET team. Okay.
But then there is also LA County PET, and sometimes LA County PET will call me about their patient and say, okay, we have your patient, and we're gonna place them in this facility, and then I'll go to our bed finders and say, can you guys find a bed? Specifically, if it's like someone who's like 12, and we're like, okay, do you have an adolescent bed available?
Yeah.
And
Right.
But they would do that because they're part of your hospital system or whatever. Okay.
Cool. So just so people know, so the PET team is like a clinician that will go and show up to somebody who's having a psychiatric crisis,
do an evaluation,
on a hold, do an evaluation, determine if they need to be placed on a hold and brought into a facility.
So now what's a hold?
All right, yeah.
Okay, so the PET team will go out there and they will assess for suicide. So what we do is try to get a low, medium, high risk. Low risk would be someone who has a passive thought, I don't want to be here anymore. And we'll generally do like a suicide safety plan with them. And I can go into detail about, if you want, like what a suicide safety plan is. Sure. And, get them linked to their psychiatrist. And then something high risk would be, I have a plan and I have the means to do it. I have the intention to do it. And then putting them on a hold, which is a
5150.
5150. Yeah. And that will mean that they are involuntarily on a hold, and they, for 72 hours, will need to be placed.
And so basically like a 5150 hold is something that we deal with all the time. And essentially from our standpoint, if somebody says that they want to hurt themselves, or if we or the police determine that they're basically a danger to themselves or a danger to other people.
Yeah, that's the three categories. Yeah, exactly.
Then they can place them on an LAPD can write the hold too. The hospital ER staff can write the hold. The PET team can be called out to write the hold. We'll get called out to like evaluate the patient medically to make sure that they're healthy enough to go to a psychiatric facility.
Yeah, they have to be cleared medically before they can be admitted to a psych facility. And just so we clear it up for people as well, when they can be, the three categories, like we were saying, are danger to self, danger to others, or gravely disabled. Danger to self, danger to others are pretty self-explanatory. Gravely disabled is just someone who can't care for themselves, basically. They're not able to do any functions to take care of their own life.
We had, I remember we had a guy one time, he was a disabled guy, he's paralyzed from the waist down. And we got called out to his house. This is, I was working down in South Central. We got called out to his house, and it was a family member that had called for us to go and check on him, basically. They hadn't heard from him, and so it was a wellness check with PD, and we get there, and we get into the house, and the guy's in a hospital bed. House is, a complete mess and disaster. Feces, places, he had a cat, and there's, animal droppings, and just a complete mess. And he's there, and he's a mess too. But fully alert and oriented. I don't want your help. Get the fuck out of my house. Oh, I don't. Who the fuck called you? I don't know, sir. Let me help you. You're covered in feces. Who the fuck asked you for help? And screaming and yelling at us. All right. What? Tell me your name. My name is blah blah blah. Okay. What city are you in? I'm in Los Angeles. Okay. What's today's date? This is the date. Shit.
Perfectly alert and oriented. What can you do?
What can I do? If this is America, if somebody's fully alert and oriented, they're able to answer those questions for me, and they tell me to leave you the fuck alone, I want to sit in my own poop, then you're allowed to do that, So we go to leave, we try to talk him into allowing us to treat him and stuff like that. We go to leave, and he goes to my partner. He goes, hey, man, hand me that knife over there. And he's like, this knife? He's like, what do you need the knife for? He's like, I'm in this house by myself. You guys just broke in here. What somebody else sees you break in and tries to break in, it's my only way to protect myself. And so my partner's like, all right, sir, here you go. Hey, take care, man. If you need us, call us back. Get the fuck out of my house. Okay. We left. Hour later, we get called back. The family member that had called had come on their own because they lived, somewhere an hour and a half away. Come to check on him, right? Because we had let them know that, hey, he didn't want our help. He's there. He's alive and well. But he had 14 stab wounds in his legs. Took that knife that we handed him and went to work on his legs. So she shows up, and now there's blood everywhere. And when we pull up, she's kind of like, he's a mess all over. And we're thinking she's talking about because he had feces on him.
Right.
And the question after, then we go in, we find the stab wounds. He's still alive. We treat him and everything. We wind up getting to the hospital. But the question after that was, is that enough? Is seeing that he's in filth and he's not taking care of it, should we have put him on a hold at that point?
Yeah, like, where's the line to determine that someone's gravely disabled?
Yeah.
Exactly. And that...
And when you were saying this, I was already like, man,
Right?
This happens so much. And as a medical social worker, too, because I used to work in the hospital inpatient, and you get this person that comes in and you heard this whole story, you read the notes, and then you're like, okay, you need in-home supportive services, you need Meals on Wheels, like here's all the resources. And they're like, I don't want that.
Nope. Yep.
And then you're like, hey, well, they're cognitively intact. And I was just, when you were saying that, like, document. Like, he said he needed the knife for this, and he didn't have any suicidal ideation at the time. And
yep.
It's a hard line because you have to also respect people's wishes and,
Right.
And that's the kind of funky thing with 5150s is where are you
Where
taking
do
away
you
their
still
liberties?
have the right? Yeah, exactly.
Where are you taking away their right to be free, basically? You know what I mean? You're making the determination.
Yeah.
And that's kind of a constant struggle because we'll get that sometimes where the cops want to put somebody on hold. Hey, she said something to her boyfriend. Talk to the boyfriend. Well, what exactly did she say? Well, she said, she doesn't want to be here anymore. All right. Well, what does she mean by that? And then, I talk to her. What exactly did you mean by that? Well, I'm in this fucking house. I've been here for 2 weeks. I don't have a car because he took it, and I don't want to be here anymore. I want to get out. Okay, but, is that what you meant at the time? And it's like, it's always a balancing game.
And it's like you were that close to being placed on a hold.
Yeah,
you don't know it. Yeah.
But so on the call too, it's like you're just combing out. You're on the conversation and you're trying to say, okay, so earlier when you said you don't want to live here anymore, can you tell me more about that?
Yeah.
What did you mean by that?
And that's kind of your job, is to pick those little things and
there's times that I hang up the call and I go to my colleague and say, you know what, they said this, and tell them what's going on. They're like, I probably would have put them on hold, and I'm like.
Yeah. Oh, yeah. The second guessing has to be crazy.
Yeah,
with that
it's
job.
crazy.
I'm sure.
And even just once you do call and I'm on the phone with them, again, I tell you guys, I'm like trying to get the information. I'm sending out the cops. They don't know because I don't want them to do anything. And they hear the sirens and they're like, did you fucking call the cops?
Right.
And then I'm like, yeah, but it's because I care about you and I'm worried about what you're saying and I don't want you to do anything to yourself, and they're here to help you. And then I hear the person come in and they'll be like, what the, mean to them. And I'm like, oh God, now they're never going to call again.
And that's got to be in the back of your head when you're making that determination to call the cops or not.
Yeah, but it's like, I would hate to actually read later that
something happened.
That they did something to themselves. Right. So it's like better safe than sorry. How bad is really the hold? And once they get there and they assess, and if they don't need to be put on a hold, then, the hold will be dropped.
Yeah.
Yeah.
And that's kind of like we were talking about like the whole defund the police thing, and how like the idea behind that is like not sending cops to situations like this
or for things like this.
Having some sort of social worker / someone that's trained with
some other
psychological
crisis
issues.
team, because cops have to get used on this a lot.
Right.
And I actually have a colleague who he told me he works with the cops and he goes out, he's a second responder. So they'll go out first and they'll call him.
See, I was going to ask about that because when we were talking about how different entities have their own pet teams, hospitals, the county, doesn't LAPD have isn't that what the SMART team is or something?
Yeah.
The SMART unit, right?
Yeah.
Okay.
So, there's avenues where they can go and, defund or redirect funds from different things to different other programs that they have for it. But the problem with that is you know, when you're dealing with somebody who's on the edge like that, like who the hell knows what you're walking into. So like, let's say you do have a crisis intervention person, an unarmed crisis intervention person, you know, who is trained to deal with people like this. But the person that he's responded to has already decided they've checked out. They made the phone call as maybe like a last, and they were convinced by the phone call or something like that. And now we send this unarmed person, and they have a gun because they already had a plan to shoot themselves, you know. And it's like that's where the question on, do you send a cop or do you send a unarmed crisis intervention person? That's where the argument
and
sits.
I think also my colleague goes in with the police. They don't go by themselves.
Yeah, it's probably smart, because
I wouldn't.
That's what I've always said, is like, that's all it's going to take is one unarmed crisis intervention person to get shot, to walk through the door and get shot, and they're going to go, oh, okay, this is why we send somebody who's trained to be ready, you know what I mean, that has a weapon and can fire back, stuff like that.
Yeah.
So it's like,
you got to find the balance.
I mean, you could have a whole show about that whole thing, but it's that's where like the argument goes back and forth with that. Because I have been on calls like that too, man, where you get a call from a family member. Hey, I was talking to my brother. He is a paranoid schizophrenic. I don't know if he's been on his meds. He's, you know, I know what he sounds like when I'm talking to him, and he hasn't been on his meds. It sounds to me like he's having an episode. It sounds like he's off his meds. I need someone to go check on him. And we've had those calls before. I had a call like that working an overtime day in Mid-Wilshire, right up the street here. And we got a call like that for a wellness check with PD, unknown medical. And that's what the note said. Patient is a paranoid schizophrenic. Family thinks he's off his meds. And we got it as a psych call. And we get there, and the cops are knocking on the door. And the guy answers the door, and he's covered in blood. I mean, head to toe covered in blood. And he had a girlfriend there that he had in the back room that he was assaulting. Just having a psychotic episode, and assaulted her. She had bloody nose and everything. But that shit happens a lot, where you show up to something that you think is going to be kind of a basic level psych call.
And then
you're
like, oh, there's blood all over the walls.
Yeah,
here. Okay.
Exactly, man.
Yeah,
and all of a sudden you go from dealing with something that's a psych issue to dealing with something that's a lot more, violent,
complex,
and a lot more complex. Yeah. But that shit happens a lot. Or you get people who are ODing, who have been on a meth binge or something like that, and are having some sort of psychotic break because of that, or are hearing voices or hallucinations or something like that because they've been up for 4 or 5 days.
Yeah.
You know, sleep deprivation, stuff like that will get people having hallucinations, stuff like that.
See, and here's the thing though, is Stacy's got to encounter that on the phone and make the determination on what
exactly.
the right thing is to do.
Yeah.
And then you're saying the scale like low risk to high risk. I mean, like, the people in this room, most people listening to the show are thinking, I woke up kind of low risk today.
Yeah.
You know what I mean? I feel low risk like half the week sometimes.
Well, especially right now
during the pandemic.
with what's going on with the pandemic and people losing their jobs, evictions that are coming up.
And I always find it interesting. Well, like, no matter what your race, socioeconomic status, it's like the brain always goes to suicide. It's like the final escape.
Yeah,
and if people already have like a predisposition, kind of like once you have thought it or gone down the road, you can always go down the road.
And those are what we look for, like as high risk cues. You know, like someone who's has a mental health issue, normally taking medications, substance abusers, all those things, and even having like a past attempt before puts you at a higher risk because now you're kind of more willing to dance that line a little bit.
Totally,
right.
Because it'll make like perfect sense to the person. Like that's the only way to go. You know what I mean? Is I'm gonna have to do this now. It's for the best for everything, and she's got to figure that out early on.
And I mean, it seems to me like people. It's very difficult for people to accept help if they haven't already determined that they want help themselves. You know what I mean?
Well, also like the callers that we get. I mean, you're not gonna call if you really are trying to take your life.
Yeah.
You're just gonna do it, and
yeah, exactly.
So these people calling, typically, even though they do have the plan, they're like, I don't want. These are scary thoughts, and they're really dark. And they probably have never shared them with anybody before, because you tell any normal person, not normal, but like person that doesn't work in the field, they're like, you want to kill your, what? Oh
Yeah,
my
yeah.
goodness.
Right.
Your mom, I mean, no one wants to tell their mom. No one wants to tell their immediate family. It's even hard to even talk to your friends. Like, you don't go, hey, man, like, I was thinking about, maybe killing myself. Like, no one says that.
Yeah.
So even being that person that's open to listening and not being shocked by it is a big relief for them, too. Okay, I've been having these thoughts, and you're like, okay, tell me more. Exactly what kind of thoughts are you having? You're willing to have that talk with them, then they're more open to sharing with you. Okay. And sometimes they're even worried about me. Well, I don't want to tell you, it's kind of graphic.
Right.
So are you thinking of shooting yourself? And I'm like, yeah, and I don't want my family to find the blood all over the wall and, clean me up. So then that's also a note for me. Cool, okay, maybe he has less intention to actually do it because he's thinking about the consequences of that, and maybe he won't really go by shooting himself and do something else.
They kind of like start on a scale with you, sort of like they go up, they go down, depending on the answers.
Yeah, and that's why you have to be super open, because then someone might not want to share that with you. And like, if you can't take it, I guess there's this like, they're trying to feel around for how much you can take and how much you're willing to listen.
Does there also become like a factor where like you have to determine how much they're telling the truth and aren't? Like, do people
I
kind of like
always
exaggerate?
believe, you just believe 100%, no matter what. You can't say, oh, they're just seeking, attention. Even with cutting, I asked, are you trying to kill yourself? Is it with the intention of killing yourself, or is it emotional release?
Yeah.
It's mostly always an emotional release.
Sure.
No one really cuts. It's rare that someone will cut to kill himself. But even knowing that, they're like, oh, okay, so she knows that I'm just cutting to feel better or feel something. Whereas mom's already freaking out, sees the cuts, and she's like, you're trying to kill yourself. And
you see cutting like that all the time, man. Especially
people
in
with
teenagers,
scars,
people with older people with scars, fresh ones on teenagers. But then you also have the teenagers that are bouncing around in different facilities and stuff like that.
And for those people, I try, like, how about you hold some ice cubes in your hand and let that pain, or use a rubber band and snap yourself where it's not leaving a mark on you where everyone knows it.
Yeah, man.
Yeah. So we're talking about once, people have called 911 or they called the crisis line, they're encountering help now. And that's the thing that we were talking about, or we're going to talk about with this episode, was the whole system set up in place once you do call for help. Once we show up, there's all these different avenues and places for people to go. And, Stacy makes a determination on if they're going to send a pet team, if you're going to send the police. Once the police get you, or their pet team, gets you and places you on a hold, then you have to make a whole other determination on what facility they go to, what's appropriate for them. If they have medical needs, they might have to be admitted to the regular hospital, but have to have, frequent psychiatric checks, be watched, have a sitter.
Yeah, so I've had someone who actually drove their car over a cliff and survived. So then he was in the hospital, placed on a hold, but we're still, they were doing all the medical thing for him, taking care of him. And then putting him on a 5150, that's for 72 hours. And then putting him on a 5250, where it's an extension for 14 days. Right. And at that time, we have a hearing for the person where, we're saying we're going to be extending the hold. This is why. And that person has a patient's right advocate, and they can also speak their piece as to why they don't think they need the hold anymore.
Is this done like in the
hospital room?
In the hospital room? But who determines
So the psychiatrist, the treating psychiatrist
is the one that will have the final say. They're like the judge.
Well, so they're the ones that I'll read their notes for. I don't know why in my organization, even though I'm not the one assessing and treating them, I'm the one presenting in this trial.
Okay.
Oh, really?
So I'll read, the notes, tell them what's going on, tell them the medications a person's taking, tell them how they tried to commit suicide. That person will say what they think happened, and then there's not a judge, but someone from the courts who are there to determine. And then I believe
it's like a mediator or something like that.
Yeah, then there's another where you can actually request a judge, and they will come to bedside and.
Okay, yeah, because I was going to say there's like a psychiatric court, right? Isn't that what the Court 95 is? Yeah, there's like a separate psychiatric court for LA County, but I don't know if I thought they do determine conservatorships and extended holds, but I guess it's not in these cases where the people are bedbound and they have to come and do it.
Yeah, I've only had it in that. I've only seen it in that setting. So I mean, we've also had somebody who was gravely disabled. He just decided not to eat. He'd barely eat like enough yogurt to keep alive.
Wow.
And just didn't care to use the restroom. He would just sit there. And we actually found out who his wife was at some point. She came in, she's like, oh, this is exactly what he would like, just to sit there and do nothing. And I'm like, lady, it's a lot more than that. He has like some cognitive impairment.
Still giving him shit.
You know, determining
Wow.
like, you know, does he need to be put on a, you know, be conserved because he's obviously not able to do this on his own.
Take care of himself.
Yeah.
And that's the same thing, you know, we're saying with this older adult, that's the same thing that we dance to is like, does he have the capacity or do we need to conserve him? And that's a big thing because that's like forever, you know, not forever, but they can't.
Until you're taken off of it, basically.
Yeah.
You're under conservatorship. And that's kind of in the news now because of
Free
Britney
Britney.
Spears. Yeah.
Free Britney.
Yeah.
It's like a whole thing. But I mean, we've got to make that determination for people every single day.
Dude, that's actually a pretty crazy story if you look into it.
Mm-hmm.
The whole Britney Spears
Oh,
story,
totally.
like her conservatorship and shit. I went down a rabbit hole with that the other day on
And that's
social
like
media,
a
dude.
scary plot for like a movie. Imagine if you're conserving, you're like,
Yeah.
but I'm fine. They're like, that's what someone psychotic would
Yeah.
say. And you're like,
And
but I
Exactly.
really am.
And that shit
Right.
really happens, man.
Yeah.
That shit really happens.
It totally could.
Do you get calls to the hotline from the elderly?
Definitely.
yeah?
Yeah. And also like the partners. So they'll be like, oh, my wife has dementia and she's in the bathroom. She locked herself in there and she's aggressive. Every time I try to open, she's swinging at me.
Yeah.
And then it's like, I'm already like, careful what you tell me because I might need to call out the police and it's going to make the situation worse. But also like, she can't just be in there with the door closed.
Yeah.
And maybe she can't live with you anymore. Maybe it's unsafe for both of you for her to live there. And gosh, are you going to hate me when they go in and remove your wife?
Yeah.
But it's like it's unsafe and I have to put the safety first.
Yeah. Our all three of our grandparents live with my parents right now. And so we're talking about like, you know, three old people in with my parents and they don't want it. You know, they're all, you know, old Mexican, you know, they want to be.
God bless your parents.
They
man. That's
want to be in
hard.
the home with the family. You know what I mean? And my parents are all for it. They're there to take care of their parents too. But, you know, both my grandmas are like beginning stages of dementia where they like don't have any memories. So they're like repetitively questioning the same question all day.
Yeah.
They'll sit at the table and like have the same back and forth for like a half hour. They'll do the same back and forth 5 times.
They're condensed
same
to
joke,
things that never happened.
She'll laugh, you know, give her crack back. She'll laugh and they'll do the same thing over and over again.
Yeah.
And dude, it's crazy. And then my grandfather was a janitor at an elementary school. That was his career. But he rode his bike everywhere. He worked on the yard himself. He took care of that entire school. He's a hard worker, you know, standard.
That's hard too, you know, someone who was physically active, able to do everything, maintaining their family, and then all of a sudden now you don't have the capacity physically to do those things. And mentally he's probably still sharp.
Yep.
And then it's like, how do you give this man dignity to age with dignity and
Yeah,
still feel like he's contributing?
And that's exactly what he's kind of going through right now because
he's recovering from a broken hip. But yeah, he didn't have surgery because he's what? How old is he? 90, 91, 94?
Yeah, 94.
He's over 90. He's north
old.
of 90.
He's old, fragile. You know what I mean? He's
Yeah.
already had both his hips operated on, and then he fell and had, you know, fractured his pelvis or his hip.
Yeah.
And the doctor's just like, well, you know, he doesn't have a whole lot of bone there. He's got osteoporosis anyways. We're not sure if we're going to repair it, and he might not make it off the table. So
Is he
now
cognitively intact? Like,
he's 100%.
Totally.
He's hilarious. You know, and that's the other thing too. Like another thing to keep an eye on with the pandemic is like my dad. So our kids and my brother's kids all go to the elementary school. It's a block away from my parents' house, right? And the kind of funny, my parents' house is actually the house my mom grew up in. So
Yeah,
when
it was our grandparents'
when
house,
we
yeah.
went, it was our grandparents' house. So when we went to
That's
school there,
beautiful, though.
all our cousins and everything, we would all go to my grandparents' house and hang out there, and all our parents would come pick us up from there.
And it was weird because we had an uncle that lived right across the street from them and an aunt that lived right across the street
Like
from them. So it
on
was
the
like
three
all
corners of
family
that
within
intersection,
like
it
4
was like our
house
whole
sections.
family.
so that was like
Randomly.
the house. The
Sorta,
house.
yeah.
Yeah, that was everyone got off school and went to our grandparents' house. It's kind of the way it works right now. My dad walks over, gets the kids from elementary school, and brings them over. So at least my grandparents had these kids, these beautiful kids with, you know, full of life, running around laughing and shit in the house and talking to them and playing with them. So it brought kind of a vibrance that their vibrant attitude into their world a little bit, where they basically just sit around all day, you know.
And it even gives them something else to do. Like maybe you're not the family provider anymore financially, but maybe you're providing these stories and
playing with the kids, and you see them light up when the kids are there. Well, now with the pandemic, we're so worried about them getting sick that none of us are going over there anymore. So even that family interaction and the interaction
and they're
that
not
they have
going
with
anywhere.
our kids,
Yeah.
you know what I mean? They don't even have that like kind of like ray of sunshine in their day. You couple that with pain and not being able to like go to the bathroom on your own, because my dad has to help him with everything now. And you couple that with my grandma kind of forgetting that he fell and has his hip and telling him, get the hell up, you know, hey, get the hell up, lazy, you know? And so you can see that my grandpa's starting to get depressed because he's not able to like get up and do his, and he'll say little things like that. Just let me go. Just let
He
me
still
die.
gets up though all the time. He's still trying. He waited like 6 weeks on a broken hip.
Yeah.
And he's like, I'm all right. I'm all right.
And
Because he doesn't feel any
if they're
pain.
not cognitively intact, they'll just like get up and try to go to the bathroom. And if your poor caregiver mother and father, like, how can you keep 24-hour watch and make sure he doesn't get up to bed? And you can't restrain him physically.
And the other side note that's interesting is our dad is like probably the most requested guest for this show. Like people message us like, you got to have your dad on the show. We want an episode with your dad.
Yeah.
That's why we can't get him. He literally is always having to watch our grandparents.
Yep.
Always.
24/7.
Yeah.
And then I worry about my parents too.
Yeah.
Because
Caregiver burnout.
there you go. I mean, that's all they do now is watch. My mom has a shop, like a cake and candy supply shop, Gloria's Cake and Candy Supply in Culver City, if you guys need anything to bake or decorate cakes or candies. Yeah. And so she gets away to do that a little bit, but my dad is there 24/7. And he used to, and talk about the pandemic again, we used to go over and at least like stay there with them, let my parents go out, you know, have a movie night or dinner or something like that. And so now with the pandemic, like
we all work in healthcare. They're like, stay the hell away from us.
Yeah, exactly.
Yeah, before, like, we used to, I mean, everyone, all the social workers were like, self-care. You got to make sure that you're taking care of yourself. We're all telling the caregivers that. Then they're like, okay, I want to go out on a date, or I want to go do my nails. Okay, now who's going to watch them? So financially, who's going to pay for the caregiver to come? Is that person reliable?
Yep.
Culturally, I feel guilt because I'm supposed to be the one.
Yep.
And it's also the other way where, like, let's say your dad's taking care of his mom, like all of a sudden now there's this role reversal where I'm taking care of her and she's a woman and I don't want to.
Yeah. And that's kind of one of the problems that we were having with our grandma too, is because our aunts live in Victorville, and you know, their home and everything was here in Venice. So my grandfather, their like world was here in Venice. They did go to Victorville and visit a lot, but my grandma wanted to be with her daughters, thinking ahead that when something like that was going to happen, if she was going to need help going to the
daughter
restroom,
is taking care of her instead of our dad.
Yeah.
And so that's another, because it just doesn't work out that they can be there. Like the housing situation, the going back and forth and stuff like that just doesn't work. With my parents is the best place for him.
Yeah.
But my grandma's constantly fighting with my dad. Well, I want to be over here, you know, because I want to be with my daughters because of this. And so you have that conflict with them too, which gets my dad frustrated, which adds to his stress level. You know what I mean?
Yeah.
It's crazy how much turmoil having
because it can cause
the
other
elders in the
stress
house
between
causes.
the siblings and everything.
Yeah, I'll have
change the whole dynamic.
The two, so like a family of 3, 2 sons and a daughter, and then they'll put everything on the daughter, but the sons will be like, well, we're financially, you know, getting you guys groceries and paying the rent. She's like, that's not it. That's, you know, look at how much I do every day.
And it's a drain. I mean, it sucks the life
Just
out of you.
spending the time and the hours and everything.
Yeah.
Because then, I mean, like, I'll feel bad about not getting there enough. You know?
Yeah. So I worry about that. Just another reason why I hope this whole thing ends.
And I wish, like, I could
soon.
give you, like, some answer that, like, this is a solution, because I know it happens so much out there. People will bring their loved one to the emergency department with their hands up, like, I just can't anymore.
Yeah.
And it's like,
Well, we'll get that call with 911 too. Like, what's the problem? There's nothing specific. It's just I can't take care of him anymore. You know, it's like, okay, all right, shit. Like, and that's our thing is
we don't have a magic wand to, like, give them that. And it's unfortunately, like, all the resources out there too. You either have to be really low income. I think that less than 2,000 in assets.
Oh wow.
Or
to get the help, to qualify for the help.
To qualify for that, yeah. I mean, your house and the car that you drive doesn't count, but 2,000, That's really low.
Yeah.
And then on the other side, it's like paying for these boarding cares or something like that. I mean,
It's expensive. Yeah. And what you can afford or what your insurance will cover, some of these places.
Some of them don't take insurance.
And I wouldn't put my worst enemy in some of these places too. Some of these boarding cares, and they're, and that's another thing that's frustrating too is when you show up and you try to be, I always try to take a step back when there's no life threat. Take a step back and okay, what's the best way to help this person? What's this hospital's capacity? They have an orthopedic hospital attached. Maybe that's where I'll take the broken arm. You know what I mean? I try to think what's the best, not just the closest place where I can dump off a patient, but where's this patient going to get the best care that they need?
Yeah.
And so when you have something like that and you have somebody call and they're like, yeah, I just can't take care of this person.
Yeah.
It's super frustrating to take them to the hospital and already like there's nothing. I know that you're going to be here.
They're going to get there. They're going to be discharged.
Yeah, they're going to watch them for a little bit, and then they're going to discharge them. They're going to be right back in the same seat. So that's why I always try to like keep track and know what hospitals have a social worker on staff.
Right.
Yeah.
Because not all hospitals have a social worker in the ER or a social worker in the hospital 24/7, and try to take people somewhere where there's a social worker. But I mean, a social worker can't even help all the time.
Yeah, that's the thing. Like placement for these people becomes like a whole other issue once they make contact with us.
That's a whole other job and career.
Oh, totally,
placement,
totally. Yeah. And I mean, there's only so many facilities that can take psych patients as admissions, like people that are going to be there for a week or be there for a month or, God knows
and if
how
they
long.
have any behavioral issues, I mean, those facilities are like, we're not going to take that risk, take that on.
Yep.
Yeah.
Or then throw in if they're under 18, if they're pregnant at all, anything, you know what I mean? And just everything can be like a monkey wrench and these people become like hot potatoes.
Yeah.
Basically.
And then when they can't find a spot to land, they wind up on the street.
Yeah.
Or
they stay in the ER. There's people who have been in the ER for like 2 weeks, 3 weeks at a time because there's literally nowhere for them to go.
I think once we had them for a year.
Yeah.
In the ER, one like just a border basically.
A bit, yeah. And there's just no place to. It just really gets really complex. We get them conserved, and the hospital every day is like telling me, what's the plan? What's the plan? How are we going to get them out?
Right.
It's like, do you want that liability of kicking this person out?
Exactly.
Yep.
We tried to explain this in a previous episode. It becomes like that movie, The Terminal. Where like they're this guy just lives in the hospital now forever.
Yeah.
And I mean, like, I don't know how it was for your place, but for USC, we had at one time like over 100 patients that were just boarders that we just had nowhere for them to go to be discharged to.
That is.
And it was like for over like a year, and it was like a fifth of the capacity of the hospital almost.
And it's funny because the hospital solution was like, we'll pay for 1 month at the boarding care, and I'm like, okay, then what?
Yeah.
And then what? Yeah, exactly.
They're
And like the
gonna send
boarding
them
care
back.
doesn't know. They're like, no.
Yeah. It's funny because my in-laws actually run a boarding care facility. Shout out TBC.
Hey.
And, I try to ask them too, okay, so like, what are the solutions? And I used to live at a skilled nursing facility. It's more like a assisted living facility.
Yeah.
So really seeing that, like, I've been in these different places and there is no solution.
Yeah.
Right.
And it kind of lends itself to like, I mean, I keep going back to this, like the whole defund the police thing. It's like reimagining everything. Like it'd be nice. That's one thing that I feel like this whole whirlwind that we've been going through for the past 4 years, really, but lately is that I think it's going to cause everybody to kind of take a step back and look at our entire system and how we do shit.
Oh, yeah.
And hopefully this is one of those things that gets looked at differently because they're trying to have the police take a step back from everything. Maybe they'll look at the process of getting somebody in a 5150 hold or a conservatorship and kind of reimagine how we deal with people like this, because too many people do get thrown by the wayside and wind up on the street.
Funding mental health services, if we could do it more, it would save so much money in the long run.
Yeah.
If you ever look at like the county operating budget, it's like 25% is to pay for everything, like everything that you use in the county, parks, roads, and like the other 75% is like mental health, jail, and sheriffs, dude.
Yeah.
You know what I'm saying?
Yeah.
It's a huge chunk when you consider it. Like just everything goes to just having to take care of people, when if we could use some of that money preventatively, maybe it wouldn't cost so much in the long run.
Yeah, I mean, a lot of people that I talk to that have substance abuse issues comes down to some type of trauma that happened when they were a child.
Yep.
And if they would have got intervention at that time, maybe they wouldn't have relied on the drugs. That wouldn't have impaired their mental status and their psych.
Yeah.
Maybe all of this could have been avoided. I don't know. You know,
It's where you catch
worth
people in
looking
their
at.
cycle, and you know you can change it from there. But if like all we do is like perpetuate it and push it further and further, now we have all these people who are just the end result of that, and they're
Yep.
all over the place.
Yeah, and it's not working.
Not at all.
Yeah, someone
not
who was
working.
abused by their father then gets put into the system, then
Yep.
they get, you know, raped and tossed around there. How are they supposed to come out of that?
Yep. You come up, you're affected by that. You use drugs or alcohol to kind of hide that pain. Now you're addicted to that. It's hard to get a job. It's like, you know, yeah, it's,
Go into prostitution, that becomes a whole other issue.
yep.
This
Man.
is the most depressing episode of PRC that we've had, folks.
Hey man,
like and subscribe.
But it's real. It's something we deal with
No,
every day,
totally.
dude.
Totally.
It's I mean, super fucking prevalent
Yeah.
in what I do, what you do, what Stacy does every single day.
Everyone in medicine, yeah.
And most people, I mean, I guarantee you, probably everybody in this room has somebody that's going through something like this
Right.
in their life, and you have no fucking idea because people hide that shit. You know what I mean?
Oh, totally.
Very well.
Even the aging thing, it doesn't come down till they're, you know, elderly, and then they come to the emergency department. The family's like, we don't even know what's available to us, and you don't know until you're in that situation.
Yeah.
And then at that point, we give you the resources, and you can either afford it or you can't. And then there's no other answer, and it's depressing. I mean, it's depressing
Yeah,
to
everyone's
be
just like
there's
hoping for the
no-
best. But that's the thing, though. This show is supposed to be reflective of the job, basically.
Yeah.
You know what I mean? And
Yeah.
not every shift is going to be happy. Not every shift's going to be funny. You know, we'll have parts of it here, parts of it there. Sometimes we're just going to deal with real shit, and that's what we did today.
Yeah. Thank you for coming on. Really appreciate it.
Thank you
I
for
want
having
to.
me. Like you said, you know, having the space to talk about aging and suicide, death, we don't really get. This doesn't really happen.
Yeah.
This is the
Nope.
cool little way that you guys are bringing about these conversations.
Do
Thanks.
you have a phone number that you want to give out that people can call if they're having any issues that they can?
Yeah, so I wanted to give out the number for the National Suicide Association. So it's 800-273-8255. Again, that's 800-273-8255. Also, there's a really cool app, My, M-Y, and the number 3, where you can put 3 different individuals that you'd like to get in contact with if you're having a problem. You can also push 911 right there. And then it also has a suicide safety plan
Oh, wow.
that you can type in and have on you. And it's, you know,
That's
private
My
in an
3?
app. My, and then the number 3.
Okay, cool. I do want to mention that the opinions and things stated here are our own. They do not reflect the opinions of the Los Angeles City Fire Department or LA County Department of Health Services.
Not at all. And we also want to say that don't feel any shame in having to take those numbers down or use those numbers if you do. Whatever you're feeling at the moment, if you are going through something like this, the outcome that you're thinking of is not going to be worth it. There's always resources for you. There's always people that are willing to help and people that are willing to listen. And there's always, you know, I don't know if this helps, but yeah, we live in moments. You live in the moment passes, you get the next moment. You know what I mean? When you feel that there's not going to be another moment, you just have to have hope and just know in your heart that it's going to come to pass.
You know, and I feel like we have a lot of subscribers and people that listen to this that are in the field, you know, medical field, fire departments, police departments, stuff like that. It's, you know, suicide, especially taking into consideration all the things that we see on a daily basis or cumulative over 15, 20, 30
Vicarious
years.
trauma that you're experiencing, PTSD.
30-year careers. I mean, PTSD is a real thing. PTSD from I always tell people, and I've talked to therapists before. You know, I've had issues where I felt like, you know, talking to somebody was something that I need to do, and it helps, man. It helps so much to talk, just to get these things off your chest.
Oh yeah.
Yeah, you know, so it's something that's prevalent, and you know, there's been five or six guys since I've been on the job that have committed suicide. Guys that I know, you know, that went off with injuries, you know, that they couldn't kick, that wound up getting hooked on pain meds and stuff like that. Who knows?
Yeah. I think of one of our classmates, man.
But PTSD in the field is real. You know, don't be afraid of it. Don't be ashamed of it. If you feel it, there are plenty of avenues for you to reach out and get help.
And not even just in the field, though, but like just in our other jobs,
general,
acting, comedy. I mean,
Yeah,
we've lost
you know.
so many people. You know what I mean? Everybody goes through something, and there's no shame in reaching out.
Especially in the climate right now with everything that everybody's going through and people losing their jobs and, you know, people worrying about being evicted and not being able to pay rent and shit like that. Like, I think now it's like a time when it's really, really, really prevalent. So take down those numbers. Don't have any shame in it. Reach out for help.
Yeah. DM me.
Non-judgmental place to go and just share what you're feeling and get the support.
Awesome. Stacy, thank you so much for coming. It was great having you on.
Yeah, you were awesome.
you.
Is there anything else that you wanted to plug? Or all right.
Where can they find you?
They can find me at Ben9Humor, Ben number 9 Humor across all platforms. And also, I found out recently that one of my jokes hit rotation now on Sirius XM.
Oh, nice.
So I don't know if it's like Heart of the City, the Kevin Hart channel and Raw Dog Comedy. The comedy channels, one of my bits is floating out there. If you see it say Ben Gonzalez, take a picture of it, send it to me. Because I don't have Sirius or XM, bro.
Me neither.
Yeah.
I'm not rich enough.
Danny.
You can find me at Danny Gonzo34 on Instagram and Twitter. And follow the podcast, PRC Pod, on Instagram. What else?
YouTube,
YouTube.
PRC Pod. Email us if you have questions, comments. You want to tell us we're awesome. You want to complain.
Or you want to come on the show.
Yeah.
You have a story to tell and you want to come on the show,
Recommend
email
a
us.
guest. Contact prcpod@gmail.com. If you want to buy our merch, we have awesome t-shirts, $20. You can Venmo either one of us.
Oh, our theme song. I want to give a shout out to Brent Williams. He's
yeah.
Brent Urban at Brent Urban on Instagram.
Yeah, we got a theme song now, Alex. We forgot to tell you.
He's a
He's a
really good artist. I've known. He's actually my next door neighbor. I've known him since he was like 5 years old. But his music is awesome. He did our theme song for us, and either today or in the next episode, I want to throw that whole song on the tail end of the episodes.
Yeah, we'll get it on today.
Yeah,
we
we'll
just
figure it
forgot. We're dumb. And that'll also remind us now to make sure we take a picture with Stacy.
Oh,
Because like
perfect,
half
yeah.
the time we forget to take pictures.
All right,
with the
thank
guests.
you. Thanks
you very much.
for coming.